I'm holding back all the funny stuff. I'm Paul's girly. She's got the cutest dimples I have ever seen.
Oh my
Oh
gosh.
my God. When I smile, it's just like potato. Is that a hot dog?
No dimples in there. Just
no dimples.
No. Look like you just came out the dirt.
He's calling you a potato?
I called myself a potato. He called me a mud person. Jesus Christ, you're racist. Oh my God. Yeah, man. When I saw her smile a second ago, I was like, do you buy those? Those are just there.
I mean, some people do buy them, but these are real.
All natural.
It's all Charlie. Charlie. Okay. Well, go ahead. Get me out of here for being a pervert.
Nah. Why? We're just going to come back to it at some point. Somehow you're going to talk about chocolate and be like, damn.
Always bet on black.
I love my dark chocolate myself. Like, all right. I'm not talking about the candy. I'm like, okay, all right. Jesus.
Darn black woman. All right, we're moving on.
Anywho, so you also talk about doing trauma-informed care, which is just central to your work. What does it look like for you in a session?
Of doing like trauma informed.
Yeah.
What the hell does that even mean, right? People always talk about it. You see always I'm trauma informed. Oh, what the fuck does that mean? You gonna give me trauma because you're informed about my trauma? I know
about it.
I'm gonna get you.
Well, I feel like with trauma informed care, before we even get into the trauma, we have to have cultural competency, because it's so important to understand how we may bring up something or impact somebody, or they may be navigating through something that they may perceive as disrespectful because of their upbringing, because of their culture. And when we're navigating through trauma-informed care, we want to make sure that we are identifying the tools that we can use to prevent putting salt in a wound when we're opening it up. Because it can take some time to even process like all the things that do come up and how many layers it adds to what we navigate through when we're dealing with something that's traumatic, right? And then when I think of trauma informed care, I think about how we go back generations, and in our upbringing or in my culture, we typically call them generational curses.
Yeah.
But in reality, when we gather more information and we see how history sometimes repeats itself, and we're understanding certain patterns in family and just like how the environment may have impacted one another, we're understanding how that curse may have been trauma that somebody had to overcome, that somebody had to navigate through. And we typically speak a lot about resilience, right? Like resilience being such a strength. And a lot of the times we're not always addressing how resilience was nothing, like we had no choice but to be resilient. We had to keep going. And when we're not addressing the things that have happened in the past or the things that have happened in our own life, we're going to keep that cycle going. So this is what I understand therapy or even trauma informed care to look like, being able to address what the cycle is and what can we do to kind of interrupt it.
Got it.
Yeah.
As Spencer was saying, how does it show up maybe with the kiddos that you work with at the high school? Because they're going through a lot of changes, a lot of stuff, relationships,
Honestly,
sports. You talked about economic issues, poverty, black and brown kids. This shit's all traumatic. Let's be real. It's all traumatic.
Literally. And that's why I say like everybody navigates through their own trauma. Because before I talk about the kids, just to give an example, even giving birth to a child can be traumatic. Some women don't even survive that.
Yeah.
So imagine literally you coming into the world and that's a traumatic experience, or you're getting born into a traumatic experience occurring in that moment, right? But to bring it back to the kids, like I truly enjoy all the work that I do with the kids and the adults, but being able to see how like they sometimes mimic their environment.
Yep.
And when they come to school, it's like they're navigating through, is this from my environment or is this part of my survival tactic? Right? Like they're navigating through so many different changes and challenges. And let's be for real, the pandemic, traumatic for so many people.
Yeah.
We have to deal with so much loss, grief. We're grieving the world that we once knew it to be. Everybody was like in isolation. And as we know, part of our development, that socialization is so important.
Mhm.
So imagine how a lot of our kids were impacted by that. So I'm in a space where we get to really address the fact that even though the pandemic is done, allegedly, we're now back in person. We're no longer wearing masks. We're all face to face and we're all dealing with something. So they get an opportunity to talk about just how social relationships impact them, how school impacts them, how family impacts them, how culture, environment, how making decisions, preparing for college, all these transitions they get to talk about and process. And they are in a very unique position because they're in a space where it's accepted to receive support, it's accepted to ask for help, it's accepted
Yeah.
to go to therapy. So it's like a space where they're actually opening up and it's so rewarding. So just seeing how all of that plays out,
Nice. Thank you.
very eye-opening, yeah.
So, what would you say is something that you, at least one thing that you wish people knew about therapy the most that they would never guess? Now, you can stick to this with like in American general, or you can talk about your culture and like Caribbean culture too, especially since, a lot of older folks, they just, therapy is just not their thing. They didn't grow up with that. So it's like, what would you say was something that you would like people to know about therapy, maybe?
Yeah. I feel like what I'm about to say may be the most cliche, but this is the first thing that came to mind. Therapy doesn't mean something's wrong with you. Like, a lot of people don't realize when you're coming to therapy, you're here to process what's going on.
Mm,
You could be processing something positive, you could also be processing something negative. You could just be processing life, period. You could just it's a space to be able to have like a soundboard and have a space where you're literally saying, "This is my undivided attention to myself for these 45 minutes to an hour." We don't get that a lot.
No.
Like we're in a space where sometimes we have to be a little bit non-negotiable with the time that we are spending with ourselves to take care of ourselves. And that's what therapy is, in my perspective, an
mm,
opportunity to take care of yourself. And I tell everybody that I work with, I'm not here to tell you what to do. I'm here to work with you. I'm like a compass to help you navigate through what decisions you have and how is this decision going to impact you. Because a lot of the times we're dealing with this sense of like wanting to control what's going to happen in the future. When in reality, we have to control what's happening where our feet are. We have to be present where our feet are. Yeah. So that's like my little
Beautiful.
thing. It does not mean something's wrong with you if you're in therapy.
I'm going to take this a bit further off of Spencer's question and be more specific. So, what would you say to any of the Black men listening to our podcast today?
Hmm.
What would you say to them?
Therapy is for everyone. And it may not be one size fits all, but it's a space where you can maybe learn a little bit more about yourself. And I know you know yourself, but maybe dive a little bit deeper and see what else comes up. Like it's okay to have a safe space to process all of what's going on because you carry a lot of weight of the world. And there's a metaphor that I learned from like one of my first jobs in the field. This bags of rocks. We have this mentality where we feel we have to carry this bag of rocks up the hill by ourselves. But in reality, there's people around us, people next to us, in front of us, behind us, who want to help us carry that weight. And you don't know how much you do to somebody else when you allow them to help you, because you may be helping them with something. You may be helping them with their bags. So you can walk up the mountain together. It doesn't have to be something that you have to deal with alone or in isolation. And even just being in this field and seeing who I am today, I feel like I learned a lot about myself as well. And I feel like that is one of the most rewarding things about navigating through mental health, because it takes a lot of like understanding yourself, understanding the kind of transference that can come up, the self awareness, and knowing like you got to make sure you're good in order to make sure anybody else is good. The same way we have to go to a doctor for our wellness checks, therapists got to make sure that our mental is good, right? And it just goes to show that we do not have to heal in isolation. That's one of the biggest things that I even learned for myself.
Yep.
Like healing is community. And for Black men or just people in general, knowing that it's a safe space to heal in community makes a big difference.
Last thing, and I'll kick it back to Spence. A lot of women listen to us. She's close to 65, 70%. What would you say to the women listening to us? What would be your advice? I want you to take a second. You can gather your thoughts if you need a second. What would you say your advice to these young women that are listening to us, that are looking for some type of help? A lot of them listen to us because of humor. A lot of them listen to us because they're neurodivergent, ADHD, autistic, anxiety, OCD, all that stuff, blah, blah, blah. A lot of them just like to hang out with us and just talk shit with, like us talking to guests. But what would your advice be to these humans, these women, on how to navigate the world? Or what would be your advice? Is this adult that seems to have some shit together? You're very well spoken as well too, because you're able to like step by step go through what you're thinking. Some of the other therapists cannot do that on this podcast. So you, advice for them, and trust me, I will take that and help out my other clients too. But what would you talk to them about? What would you say to them right now?
I feel like one of the first things that come to mind, or there's like two things. The first thing is you did the first step by seeking the resources, right? Like this podcast is a resource. So even if it's for humor, even if it's for information, you did something because you said, I'm interested in maybe understanding this a little bit better. You took that first step. So give yourself credit for that.
Hey, thanks for watching this video. Check out the full episode on our channel and anywhere you find podcasts. Also, remember to like and subscribe. Whoop whoop!